Hello friends, I am Dr. Shreyashi Chatterjee, medicine specialist, diabetes and hormone specialist, and you are watching Dr. Shreyashi Chatterjee. Friends, today we are going to talk about tingling and numbness in the hands and feet. In today's video, we will discuss what you should do if you experience tingling in the hands and feet, what medicines may be used, what precautions you should take at home, what tests may be needed, and which serious diseases can sometimes cause these symptoms. In Part 1, we discussed how diabetes, vitamin B12 deficiency, pinched nerves, thyroid problems, weakness, and other conditions can cause tingling and numbness. If you have not watched Part 1 yet, make sure to watch it as well. So friends, let's begin. Many people tell me, "Doctor, my feet burn at night. It feels like ants are crawling. My hands go numb. When I wake up, my hands feel heavy." Some people even get scared, thinking it may be paralysis or stroke. Friends, every case is not dangerous, but if it keeps happening repeatedly, it should not be ignored. First, let's talk about what you can do at home. If you sit for long hours, get up every 30 minutes. Walk a little. Move your hands and feet regularly. Nowadays, many people spend hours using phones and computers with their neck bent forward. This can put pressure on the neck nerves and cause tingling in the hands. That is why good posture is very important. If you do typing, editing, stitching, desk work, or long bike rides, take breaks in between. Now let's talk about foot care, especially if you have diabetes. Friends, in diabetes, nerves can slowly become damaged. First, there may be burning sensation, then tingling, then numbness. And sometimes, people may not even notice injuries. So check your feet every night. Look for cuts, blisters, swelling, or redness. Wear soft, comfortable shoes. Avoid walking barefoot. Now, let's talk about diet. Vitamin B12 and vitamin D deficiency are very common nowadays, and they can weaken the nerves. So include foods like milk, yogurt, eggs, green vegetables, lentils, and fruits. Avoid extreme dieting. Reduce or stop smoking and alcohol consumption because alcohol can damage the nerves further. Now, let's talk about exercise. Daily walking can help improve blood circulation, nerve health, and blood sugar control. Some people also benefit from yoga or Tai Chi. If leg pain is severe, swimming or water exercises may help. Now, friends, the most common question: how is it treated? The most important thing is, treatment depends on the cause. If blood sugar is high, diabetes must be controlled. If vitamin B12 is low, vitamin B12 injections or tablets may be needed. Sometimes vitamin B12 injections around 1,000 micrograms are given initially daily or weekly, and later tablets may be continued. If thyroid disease is present, that must also be treated. If nerves in the neck or lower back are compressed, physiotherapy, exercises, or sometimes surgery may be needed. Now let's talk about medicines. For mild pain, certain painkillers may sometimes be used. But friends, do not take painkillers repeatedly without medical advice. They can affect the kidneys and stomach. Medicines commonly used for nerve pain include gabapentin and pregabalin. They help reduce nerve pain and burning sensation. Gabapentin may sometimes be started at around 100 or 300 milligrams at night. Pregabalin may sometimes be started at around 25 or 50 milligrams at night, but every patient is different. The dose depends on age, kidney function, medical conditions, and other medicines. These medicines can cause sleepiness, dizziness, and drowsiness, so always take them under medical supervision. Some people may also use lidocaine cream or lidocaine patches over the painful area. Medicines like amitriptyline, nortriptyline, duloxetine, venlafaxine, or desvenlafaxine may also be used. Amitriptyline may sometimes be started at around 10 or 25 milligrams at night. Duloxetine may sometimes be started at around 30 milligrams and later increased up to 60 milligrams. Friends, do not panic hearing these names. These medicines are not used only for depression. They are also commonly used for nerve pain, but they can have side effects like sleepiness, dry mouth, constipation, or dizziness, so never take them without medical advice. Now let's talk about physiotherapy. If there is difficulty walking, poor balance, or muscle weakness, physiotherapy can help a lot. Some people may also need braces, a cane, or a walker. Now, friends, many people ask, "Doctor, is there any vitamin or supplement that helps?" In some people, alpha-lipoic acid may be used, especially in diabetic neuropathy. It may sometimes be used in doses around 300 or 600 milligrams, but it can affect blood sugar levels, so do not take it without medical advice. Some people may also use supplements like acetyl L-carnitine, especially after chemotherapy-related nerve problems. Now let's talk about alternative therapies. Some people feel relief with acupuncture. Thin needles are inserted into specific points of the body. If you try it, make sure it is done by a trained practitioner. Now, friends, certain tests may also be needed, such as blood tests, blood sugar tests, vitamin tests, thyroid, kidney, and liver tests. Some people may also need MRI or CT scans, and sometimes nerve conduction studies and EMG tests are done to check nerve and muscle function. In rare cases, skin biopsy or nerve biopsy may also be needed. Now let's talk about advanced treatments. Some people may need scrambler therapy or spinal cord stimulation. In certain autoimmune diseases, steroids, plasma exchange, or intravenous immune globulin therapy may also be used. But friends, these treatments are not needed for everyone. And the most important thing, if there is sudden weakness in the hands or legs, difficulty walking, facial drooping, or trouble speaking, seek immediate medical attention, because sometimes this can be a medical emergency. So friends, if you found this video helpful, please share it. And do not forget to subscribe to the channel. Thank you.